at the end of the facilitated sessions, he said it was just so valuable to have a tool, a process, and a partner in his healthcare journey. We're encouraging a journey, the process, but we're also standing alongside these people as they believe and then act accordingly.
Welcome to the Positive Medicine Podcast. Join me today with my guest, Dr. Andrew Corin. Andrew is a GP here in New Zealand. Andrew is introducing positive medicine into his practice for his patients. He's also introducing it into his own life. Andrew's story starts when he was at medical school, training to be a doctor and realizing that something was missing. Medicine, as he was taught it, as I was taught it, is lacking in a whole person view of health. Hear Andrew as he describes how he's been working with his patients and the outcomes that he is achieving. Consider how this applies in your life too. I really hope you enjoy this episode. Andrew, welcome.
Thank you, David. It's a pleasure to join you on this platform and in this community.
So we can take this anywhere we want to, Andrew, because this is the journey that we're on together. And one of the themes that comes up time and time again for us in positive medicine is that life is a journey. And we actually talk about the hero's journey and the recognition that we're all on our own hero's journey. And along the way, we will meet up with fellow travelers, which is where we've landed. But hey, do you want to go back and just explain to our listeners how we came to be interconnected on our journeys together?
Yeah, I'd love to. And as you know already, David, I love storytelling. And I think it's storytelling is a very important way of building connection and building empathy in our lives and in our communities. So any invitation to tell a story is a little bit dangerous because I could go on for a bit longer than you intended. So feel free to cut me off if you need to. I've been a general practitioner for a few decades now, and throughout my career as a doctor, which started in a research space, I've always been motivated to challenge conventional thinking where I think that it might be a bit outdated or not fit for purpose. I've been keen to deconstruct existing ways of doing things and reconstruct new and better ways of doing things if and when I have the opportunity and the motivation to do that. So it's always been something that's been on my mind to examine what we're doing. Could we do it better, and how can we do that? And certainly in the healthcare sector, there are always frustrations where we would like to see outcomes that are a lot better than what we can deliver because of system limitations, because of funding restrictions, because of the nuances of relationships with patients and the style of relationship that exists clinically between doctors and patients. And my frustrations, particularly in this second half of my career, I guess, have become more intense and palpable because I felt myself personally becoming quite burnt out, a bit disillusioned, certainly very frustrated with the environment I'm working in, and it just not filling my tank with as much joy and professional satisfaction as I really feel like I deserve and I should have in this job that I've invested in so much, in this calling that I've invested so much in. So I've been motivated to explore new ways of doing what I'm trying to do in a way that places the patient certainly in the middle of the journey, where the patient can be empowered and enabled to direct what's going on. And we talk about that a lot in medicine, patient-centered healthcare. And I think a lot of the time it's lip service because our system doesn't really support patient-centered care. So you really have to be quite intentional and brave to try and disrupt that and rebuild something that does actually meaningfully place the patient at the center. But I have found a few ways to do that have actually helped me recover some of the joy and professional satisfaction in my role. And through that, in recent years, it was a delight to come across, David, your book, Positive Medicine, Disrupting the Future of Medical Practice, and to realize that you and I have been on fairly aligned journeys over the last few years in very different spaces. And so from encountering you on paper, there was then a lovely opportunity to meet you in person and to realize that this was a collaboration that could have quite meaningful outcomes for both of us and for the healthcare sector and patients in general. So that was the journey, more or less, to this space.
Yeah. And of course, so it was actually a phone call from your practice, from one of the practice owners, Jane, and she'd asked for a couple more copies of my book, and I was intrigued, and Jane said, we're just exploring the possibility of introducing positive medicine into our practice. We're planning an away day to actually explore that, and I just said, can I come? Because this was my dream. I actually had seen this happening. Having been on my own positive medicine journey for 10 years, I actually thought it was another 10 years before I'd be talking about introducing it into general practice. So what a huge opportunity. And it was with great delight that I came on that away day with yourself, Jane, Murray, and your practice manager. Debbie, that's right. Do you want to take us to that day and how that day went?
Yes, and building up to that and the motivation that Jane expressed to you around wanting to introduce positive medicine into our practice, one of the principles and philosophies here at Family Doctors that I feel very strongly resonates is that the most important person, and this may sound a little bit controversial to you, David, but the most important person in a consultation is the clinician, not the patient. Now, this was a statement made to me by the practice owner, and it stunned me when I first heard it. But then we unpacked that a little bit, and it didn't take long to realize, this is a well-made statement. Because if the clinician is not well, then they are not going to be able to deliver and support good healthcare to their patients. So the priority from the owners of the practice was to take care of their staff, to make sure they were on a well-being journey and certainly supported to be in a well space, so that they in turn could provide quality and even excellent healthcare services to their patients. So that was the motivation behind Jane reaching out to yourself, is because we had this value that places well-being for the medical staff very highly. And at the same time, we'd just been through that pretty tough journey of the pandemic, where everybody in the health sector had been working incredibly hard with limited resources and was understandably feeling very, very worn out and exhausted and somewhat stressed. And so we'd taken some time as a practice to just get the temperature of the staff around their stress levels and their stress management strategies and any ways that we could support them in that journey of managing stress and burnout well. And one of the answers to that was to make available to them one of the resources from Positive Medicine, and that was Project Me. And so this was the space that we were in as we came into the away day with yourself, just to explore the elements of the environment we're working in, what our frustrations are, and what are the opportunities and the potentials to do these things better, and then how can we go about doing that. And we had a lovely day together, in talking very much in broad terms about the philosophy of what we're doing, the environment that we're working in, and then maybe some solutions and strategies to move forward. And I think we all finished that day with a real sense of this is something that's got legs, that can actually make a big difference in our space, and there's a huge amount of work to be done. And I'm very mindful of that when you're working in a very well-entrenched sector with certain ways of doing things, the ruts that you get stuck in are very deep. and it's very hard to move out of those ruts, and it's very uncomfortable to do that as well. And so there's a certain element of courage and willingness to be vulnerable that we need to take on in this journey for yourself and the positive medicine community, and for us in trying to make this work in our space.
Yeah. And Andrew, my recollection of that day is that you steered us through the process of exploring this together really skillfully. And we started at a very high level. We started at a very philosophical level. And there was a lot of time in that day to reflect and go inwards and listen to our intuition. And it was in the beautiful setting of that magnificent garden that Jane and Murray have around our home. And it was a beautiful day. And we kept having breaks and just spending time in solitude in the garden, just connecting with nature, connecting with ourselves, just to really check in to make sure that we were going in the right direction with this. But what you did was to take us into a more and more concrete level of, okay, so this is really good in theory. What could it look like in practice? So why don't you just share where we landed in terms of the kind of concrete measures the practice could take to implement?
So the first of those concrete measures was to make Project Me, and I think, correct me if I'm wrong, David, but the latest iteration of that is Healing Me, from the positive medicine suite of products. So to make Project Me available to all of our staff, and this wasn't a compulsory thing, but it was in response to us wanting to support them in their journey of well-being. And so we invited them to take part. We provided the resource to them for free, and we had a good uptake on that from the staff. So the first step was really to educate and inform and empower our staff to be able to be in a better place as providers of healthcare in the primary sector. The other thing that motivates me very highly is having an evidence base to important decisions that we're making. Having been trained in that model, researching in that model, and trying to practice as much as is reasonable in that model, having with an awareness that there is a great degree of the art to what we do as well as the science of what we do in medicine. And so with your encouragement, I designed a project that was a proof of concept project, really, a pilot study to explore how we could apply some of this thinking into a general practice setting. And so what I did was very carefully and consideredly designed the project and selected patients to participate in the study. And I had a few criteria here, and unlike a lot of research studies where randomized allocation and somewhat blinded allocation of patients is important, this was not at all what a pilot study should be doing. A pilot study is there to identify the right questions to ask and where a bigger study is more important. So I designed this by selecting a group of 8 patients, diverse ethnicities, genders, health conditions, and ages. And I wanted that diversity to be able to give me as much useful feedback as I could across the diversity. And we spent a month together going through a facilitated version of the Project Me package. So this was exploring the 4 pillars, guided by yourself through video modules. And we did this, there were 90-minute sessions once a week for 4 weeks. And
this is in a group setting. Sorry, Andrew. This is in a group setting. Yes. Yeah, which is again not quite traditional in general practice.
No. So there's a lot about this that's atypical in a general practice setting. But I think certainly in a resource constrained environment, we need to be thinking creatively about how we can do what we need to do better. And one-on-one, when you've got very limited access to doctors and nurses, is not a particularly efficient way of delivering meaningful healthcare. But I chose 8 people because I think from a group dynamics, that was the right number. And it just so happened also that that was the perfect number in the space that we were meeting. So it was very comfortable. Nobody knew each other apart from me knowing all of these patients. Nobody knew each other beforehand, but very quickly through the level of sharing that we were able to facilitate, quite deep relationships were formed over those 4 weeks, which was fascinating. Patients engaged. These patients engaged very well, not just with the Project Me package, but they were able to provide a lot of very useful feedback out of that as well. So having done that, the intent was to then follow up with individual sessions with each of those 8 patients to apply what they'd learned from Project Me, where they had become empowered and motivated to be the project managers of their own lives, to meet with them individually and identify what their particular health needs were, and to develop a plan over the next year or so that they could be accountable to personally, but also that I could hold them accountable to as well, because I then will meet with them again after 6 months and then again after a year. And my thinking in this pilot study is to then have 3 points of contact over the space of a year, and during that time to be measuring what we can measure. So I've got a number of tools to measure whether we're talking about pain levels from arthritis, exacerbations and symptom control from COPD, diabetes outcomes, various mental health questionnaires. So we're measuring things as we go, because at the end of the pilot project, I want not just to have some qualitative information, I want some quantitative information as well. And one of the interesting things that came out of the initial facilitated sessions was around the self-efficacy scores. And we can provide an image that shows the outcomes from those self-efficacy scores, which were quite dramatic, going from relatively high at the beginning to much higher at the end of 4 weeks, just after 4 weeks of meeting 4 times over 90 minutes, and with the very valuable videos that David provided for us. Each of these patients landed at a very significant level of self-efficacy for what they needed to then be doing about their health journey and taking charge, which was really encouraging. One of the comments that Gail from Positive Medicine fed back to me when she saw those numbers was that she was very surprised at how high the increase in self-efficacy was. And her suggestion was that was because the modules, the facilitated sessions, were delivered by a doctor. Now, I tend to be somewhat self-deprecating about my influence in the world, but Gail's suggestion was that because these messages are being delivered by a doctor, and perhaps by their doctor, it carried a lot more weight, and it was able to deliver significantly higher levels of self-efficacy gain than Positive Medicine had seen with other measures of groups. An interesting observation, and I think that it's important to bear this in mind when we think about how we can strategically deliver these sorts of projects in the future, is the person delivering the product, or at least the person endorsing the product, can make a difference. And for better or worse, those of us who are entrusted, highly valued and esteemed positions in society, have a responsibility to step into that space.
Yeah, no, absolutely. No, I think we mustn't underestimate the power of what doctors say, which can definitely have positive influences and provide hope, but can equally go the other way and can disempower and can take away hope. If the answer is, oh, I'm really sorry, there's no treatment for what you've got, which of course in medicine is often the case. So I think really important for us to remember that. But let's just back up a couple of steps and talk about self-efficacy, bearing in mind that might be an expression that not all of our audience have heard. And so could you explain what it is and why it is so important in healthcare?
I think the summary statement that I would make is that it's about agency. Who has agency to make a difference? And we do encounter a lot of our patients, particularly those who've become familiar in the old school model, that The doctor is the person who has all the information, all the knowledge, makes the best decisions. You just tell me what to do and I will do it, doc. And we know that that actually doesn't work out in the long run for lots of reasons. And we don't need to unpack that, but that's part of the journey that I've been through in my career of realizing this isn't a particularly functional way of seeing healthy outcomes for people. So the agency that the patient has involves having a sense of understanding of their health and social and cultural situation and how that can impact on their life and their well-being, to have resources available to them to support that journey, and to have permission to make decisions that are in their best interest. And the reality is sometimes that won't perfectly align with a Western evidence-based trained doctor, but that's not to say that it's unhealthy or inappropriate. And I think the most functional and flourishing relationships that exist in healthcare are those where truly we're working in partnership, where we understand each other's role and responsibilities and what we can bring to the table, but that ultimately the patient is the one who needs to be at the center because the decisions that are being made are impacting on them most significantly. So when it comes to self-efficacy, it's about the patient having a sense of ownership, perhaps control. The reality is sometimes we're feeling completely out of control, and so that's not necessarily a sign that there's lack of self-efficacy. Sometimes life is just terrible. But the patient has a sense that they are being resourced and supported and guided to be in control of their lives across all of the different pillars.
Yeah, yeah. And I think the other word I'd put in there is belief, self-belief that they can take control of what happens in their lives and not be the victims of life circumstances. As you say, even though when we're working with our patients, they're often going through very, very challenging times. It's actually all about how they respond to those challenges. And that's where the partnership role comes in as well, that for them to feel that they have a healthcare professional at their side to support them, but not take responsibility for what happens or how it should happen. So the partnership is also of two experts. The doctor as experts in the understanding of health, disease, and the management of disease, and you, the patient, as expert in your own life. You are the world expert in your own life. Nobody comes close to what you know about your own life. So it's actually the empowering of that person to realize that. And I do have those conversations with patients. And it's amazing how surprised they are when they go, oh my goodness, I am the expert in my own life. So yeah. And I think part of what excites me so much about positive medicine as a model and the idea of introducing it into general practice is that there's so much satisfaction for both parties. And it does change the dynamic between doctor and patient on that partnership level. So yeah, no, it's wonderful to hear how that's going. And so do you want to just give us some examples of some of the feedback you're getting from your patients?
Yes, one of the comments from the youngest member of the group, he was a chap in his mid-20s, and this aligns with what you just said, David, that at the end of the facilitated sessions, he said it was just so valuable to have a tool, a process, and a partner in his healthcare journey. And I think that iterates quite nicely, what we're talking about here, that we're giving resources, we're encouraging a journey, the process, but we're also standing alongside these people as they believe and then act accordingly. So that was nice feedback. I had a really interesting encounter. In fact, all of my encounters with these patients, when I sat down with them for the follow-up session individually, they were all fascinating and beautiful. And as you say, David, they filled my tank, which has become a little bit empty and dry in recent years. But this encounter that I had with patients individually and in quite a deep way was very refreshing and invigorating for me in my practice. The interesting thing, this is part of the value of the pilot, was just exploring how much time we needed to give to this sort of thing. And I'd allocated, my normal consultations with patients are 15 minutes. And I'm extremely efficient with time management. I'm good at doing a lot of stuff in that 15 minutes, as most of us in general practice are, because we're so resource constrained. We have to do a lot in a limited time. But I've been very generous to myself, I thought. I gave myself 45 minutes with each of these patients for their follow-up. And it was a delight and an eye-opening experience when I sat down with these people. That 45 minutes was nowhere near enough to explore their health journeys, their heroes' quests, in light of what they'd learned about themselves and their self-efficacy improvements. And it was so good because patients were clearly getting it and diving very deeply into their lives. And identifying some really, really meaningful goals and strategies to get there. And it was lovely for me because I got to connect with these patients in a much deeper way than I did in my 15-minute sessions. And I found myself weeping, actually, with patients. And one event in particular, I started weeping before the patient did, just because our empathic connection or empathic immersion was so functional that she, in her conversations about stuff that was deep for her, started to unpack stuff that was quite deep and meaningful for me. And unlike a lot of our training as doctors, where we're told to keep boundaries and to be somewhat emotionally distanced from our patients, the fact that we were so vulnerable emotionally with each other allowed us to connect and I think have a far more meaningful health interaction in that consultation, that relationship, than we otherwise would have. So that was really lovely. The interesting thing for me through those initial sessions with all of the patients is that a lot of the medical focus on things was placed secondary to lifestyle priorities. And we know from extensive research that virtually every condition that afflicts us as human beings, including cancer, the best outcomes from treatment are lifestyle-based treatments, not chemical-based or surgical-based treatments. And we can get very distracted as physicians and surgeons, thinking that our tools are the best tools, and that's what we want to be focusing on. But actually, it's these lifestyle changes that patients were identifying needed to be a priority for them that I was able to really endorse. And these are simple things, better sleep, exercise, weight management, relationships, time to reflect. And I think one of the real valuable aspects of the Project Me tool that you curate, David, is lots of pauses and lots of time for reflection. And I think that that's where we can get trapped in our busy lives, is that we don't stop enough to reflect and to ask some searching questions of ourselves. And once we do, we can start to unpack some of these important beliefs that are helpful or unhelpful in our health journey and our hero's quest.
Hey, while you're here, why don't you come and join us in the free Positive Medicine community, where like-minded people gather to follow our journey as we're evolving healthcare for humanity. Click on the link below, come to positivemedicine.com, join us today.
Yeah, you're taking my thinking in so many different directions, Andrew. And I think one of the major points here is that in that time, that extended time that you're spending with these patients in empathic immersion, you are sharing a life experience, you're sharing emotions with them. The immersion means that you're bringing every part of you into that discussion with them to such an extent that you're sharing your emotions with them so that you can weep before they weep. And I've had the same experience, and I've had some awful traumatic discussions with patients, and within minutes we've been laughing with each other, and the tension is broken, and then creative solutions can appear. But I think in terms of lifestyle choices and lifestyle decisions they can make, I was so pleased that you actually included relationships in that, which is the third pillar of health, our emotional health, our relationships, and how we bring love into the lives of others just as they bring love into our lives. And that period of reflection is important. I recall one client saying to me that the relationship he has with his wife was fine, and physical intimacy is a rarity, but it's just how it is, and it's fine. It's okay. And he came back to see me the next week and he said, I've been thinking, and it's not okay. We've become distant. We've become mates. We've not got the relationship we had. And I really would value your input and advice as to what I can do about that and how I can work with my wife so that we can explore what that might mean for us. And of course, although he asked for my advice, I rarely, if ever, give advice, because one of the key principles we work to is the answers are always within. So, but I did help him to explore what options he might have, and he came up with some really creative solutions. So the opportunity to have that time and the pauses to reflect is so important. How do we achieve this in a public system with 15-minute appointments? What do you think?
Yeah, it's such an important question. And because it's a hard question, it's easy to run away from it. It's not a question we should run away from, because...
No, I'm not going to let you, Andrew. I'm not going to let you run away from it.
I think we understand and agree that the spiritual pillar, the pillar that speaks to purpose and deep motivations and a sense of meaning, what am I here for? That pillar is the most important one, because without that understanding, we don't really touch, and certainly don't dig deep beneath the surface of the other pillars. And as Friedrich Nietzsche said, if we've got a why, we can face any how. And in other words, when life is tough, and we all encounter challenges in life, if we've got a sense of purpose and a deep motivation, that can get us through the challenges that exist. So to me, the spiritual pillar is key. And that was a focus for me, to try and explore a method within a 15-minute consultation to get to grips with that. And I did this a few years ago through a project that I called My Best Day. And essentially what I did, and to be fair, this is outside of the 15-minute consultation, but I just invited my patients to reflect on what their best day would look like, given their current life situation. If tomorrow you could do your best day, what would that look like? Describe it in a sentence or two, and give that to me, because I'll use that as a surrogate for what your sense of priorities or meaning, or what the things that really drive you might be. And I was really convinced that this was a gap in my understanding of my patients that was really important to fill, because it would then help guide me in therapeutic decisions. And there were two interesting things that came out of this. One was, so many patients were stunned to be asked to reflect on this and had never done it before. It was new territory for them, and they loved it. And one person fed back very negatively, "Oh, why haven't you asked me about this before? This is so important." And I took that as a very welcome slap on the wrist, that yes, I had missed a really important part of the healthcare journey with these people. So for a number of them, there were some patients who said, "Oh, this is just too hard for me to think about." I can't do it. And we had to do some work on that. And a number of my patients placed it in prominent places, the question in prominent places, like on the fridge door, because they recognized as I encouraged them with a reflection from a Buddhist writer called Stephen Batchelor, who basically encourages a Tibetan Buddhist reflection that says, since death alone is certain, what should I do? Since death alone is certain, what should I do? And in light of our mortality, and we don't know what tomorrow is going to bring us, what should I do today, given whatever my life motivations and priorities are? So some patients would do that. They'd stick it on the fridge as a reminder every day to ask that question: what should I do today, in light of the things that are important to me? And so I was able to extract from these patients, hundreds of them, some really important understanding of what was important to them in life, and that meaningfully impacted on decisions that we were making in their healthcare journey. So that was for me, it was a relatively simple way of getting some critically important information into the consultation, because then I placed it onto the computer system on the list of health issues for each patient right there at the top. In red was this answer that they provided me with. And so that not only guided me, but when I sent referrals into the public sector or to private specialists, that would appear. And it was a delight to have some specialists ringing me back when they were making treatment decisions for patients in the hospital and say, we've seen this on your referral letter. What does it mean? And I would explain it, and they were able to say, oh, that's really helpful because it will impact on the decisions that we make and how we treat this particular person. So that's one strategy. The reality is in primary care and general practice, David, the thing I love about it and its incredible strength is continuity of care and relationship. So we build relationship with patients over a long period of time, and because we have points of contact over a long period of time, we can do this work, even though there might only be 15-minute aliquots here and there. It's cumulative, and we can do a little bit of relationship building each time and digging a bit deeper each time. I had one of my most meaningful interactions with a patient a number of years ago now was an old war veteran who'd served in a regiment in North Africa that was the beginning of the SAS. And he, like many war vets, had been significantly traumatized by his war experiences and just would never talk about it. And he suffered post-traumatic anxiety from the war. And I saw him for many years dealing with his skin cancers from being exposed to the sun in the desert and his mental health issues. And over a period of some time, our relationship got deeper and deeper. And one day he came into my consulting room and extracted a couple of old sepia photographs from his jacket and laid them on the bench. And without saying anything, he just put them there, and his eyes welled up with tears. And these images were of his tank regiment and his SAS regiment in North Africa. And his wife came in at the end of the consultation. We had a little chat about that. And she said, Sid has never, ever shown those to anybody. He's never told those stories before. And I felt so incredibly privileged to be in that space where he could open up and I could understand some of his deep feelings and deep motivations that came out of that space. And that's just one example of how valuable the clinical relationship can be and how that can lead to really good healthcare. The system at the moment, which is very broken, discourages continuity of care, access to your doctor or the same doctor, but we need to fight for this. And I'm very motivated to fight very hard for this model where relationship and continuity is preserved. And so I think we can do some of this work, David, that instead of 45 minutes to an hour plus in a setting, and I think we can do that work as well. That's a new model that we can introduce into the sector. But we can do, in the current model, we can do some of this work if we're prepared to make those connections and empathically immerse ourselves in our relationships over time. And yeah, it can be done, but it's not as highly functional as doing it in one setting. And I'm excited to explore what that might look like in this new model that we're considering.
Andrew, that was an amazing answer. I thought you were going to dodge it at first, but you absolutely didn't. You came right back in, and basically you said we need health system design. We need to do what we can within the current model, but we actually need to work together to fight for general practice, to fight for its role in continuity of care. Sorry, I'm only just paraphrasing you, but I'm going somewhere different as well. It's interesting. A couple of years back, the Royal College of GPs of London produced a vision document for the future of general practice in 2030. And their vision was that the average consultation time now in the UK is 10 minutes. And their vision that was by 2030, it will have got to 15 minutes. And I read that and I went, no, that's just a perpetuation of the current model. And we've got 15 minutes here in New Zealand. And it's not enough. It's not enough to deal with patients as we're currently dealing with them, with the throughput there is. So we need to look at allocation of resource and who does what. But the goal must be for specialist GPs with that continuity of care to have 45-minute appointments, to have 60-minute appointments. My first appointments with patients are an hour and a half. And they come out of that with a sense that I know them at least as well as their best mate does. And quite often they say, I've actually never told anyone that before. And that's the very first time I've ever met them. But the ability to create a safe space and hold space for them means that they're safe enough to share. And that's what your veteran experienced. He experienced feeling safe and going into a place that he was even scared of himself experiencing, let alone sharing it with another human being. So I think it's inspirational to hear you tell those stories, and I'm sure that any doctors watching this are thinking, this is what medicine should be like. This is why I went into medical school. And actually, correct me if I'm wrong, but I think in one of our very early discussions, you actually told me that you even realized in your medical student training that the model you were being taught was deficient, that it wasn't what you were expecting.
It's true.
So we talk about the 4 pillars of health: physical, psychological, emotional, our relationships, and spiritual health, what brings meaning and purpose to life. We encourage our patients to lead positive medicine lives, to have a plan in all 4 pillars. What does your positive medicine life look like, Andrew? How do you apply the 4 pillars model in your life?
Okay, so you're digging very deep personally now into me rather than my...
Yeah, forget we're in a podcast.
Yeah, that's a good question, and I could pull out. In fact, I might do that because I've got it right here. The workbook, because of course this is old school stuff now. But the workbook...
Yeah, that's Project Me, isn't it?
Yeah, so I went through this personally, and as a facilitator, it was brilliant to then go through it again, because as I was facilitating patients to go through this, I revisited stuff that I'd done, and it was really valuable to add to it, to make lots of notes, and to create some Project Me timelines. I can provide, out of interest, if you want to see the document in any more detail with what patients have come up with. See, I'm dodging your question, but we'll provide this as well, perhaps with the podcast, just the framing for how I...
Yeah, fascinating, Andrew. Anyway, back to you.
For me, as I've said, the spiritual pillar is the most important one. and that one is a journey that I have loved being on, particularly perhaps in the last 20 years, where I've deconstructed a lot of my own sense of what was important in life, because that's what other people told me, and reconstructed what actually is important to me. And it's an opportunity to make reference to some of the writings of Bonnie Ware, who is an Australian palliative care nurse. She did a lot of work with people when they were dying, and she's written and spoken extensively on the five biggest regrets of people when they're dying. And I've got them up in front of me here, the top 5 regrets of the dying. And the number one regret at the top of that list is, I wish I'd had the courage to live a life true to myself, not the life others expected of me. I wish I'd had the courage to live a life true to myself, not the life others expected of me. And so tragic that people at the end of their life were identifying that they'd missed the boat. They'd not been honest to themselves and what they really wanted in life. They'd succumbed to expectations of others. So for me personally, this is a journey in the last 20 years or so of what does Andrew really find meaning in? What's important for me? What's my sense of purpose and motivation in life? And for me, that's very much around exploring my philosophical motivations and making sure that these align with my actions and my practices. And I think oftentimes I've been caught out with a disconnect between what I feel is important, but what the system or the people around me demand of me, and then finding ways to express my deep philosophical motivations through my work, through my relationships with friends and family, at home and on the sports field. So just trying to get alignment there. And if I've got alignment in my expression of what's deep within me, then it means that these other pillars can be functional, can hold the roof up more effectively. So for me, I'm in a space at the moment, relationally and emotionally, that's really challenging. Just in the last few weeks, my 20-year-old daughter and my 16-year-old son have left home. And so my wife, Kathy, and I have gone from being a really highly connected family, with my daughter and my son both living at home and us being very involved in their lives, to them leaving to Australia and to the other island in New Zealand, being very far away from us and having an absolute ball, just loving their opportunity to be independent and flex their wings and fly in directions that are really new and exciting for them. But it's left us with a big hole. And as much as my wife and I have a great relationship, our relationship has been built very much around our children and their needs and our shared motivations to do the best for them. So now we're in a space where we're needing to explore what our relationship looks like, what our relationship with our children looks like, because that's very different now with them far away and variable levels of communication. And so we, interestingly, I'm quite an extrovert and my wife is an introvert, but I've actually found myself just really valuing a lot of quiet, introvert-like time with her, being away at the beach or walking in the bush. I'm just not seeking a lot of other people at the moment. I think I'm not quite sure I understand why, but it's what my emotions and my psychological machinations are telling me at the moment is I just need to spend a bit more quiet time reconstructing what that relationship looks like with my wife. From an emotional point of view, of course, from a psychological point of view, that's all very much connected. I have an extremely busy life professionally. So as well as being a general practitioner and a researcher, in my clinical director role, there's a lot of work to be done there. I'm a writer, soon to publish a historical fiction novel. I podcast and I blog. I grow avocados. So life is very full. And for me, I'm very much an active relaxer. That's part of my self-care, but also it's a risk because I can distract myself from good psychological care just by being busy. So one of the other practices that I've put in place in recent years has been a contemplation circle in my garden. So underneath some towering olive trees and a grapevine and some pahudakawa trees, I've built a labyrinth, which in those of the listeners who know old cathedrals, in an alcove of a cathedral, there's often a labyrinth, which is a circle of pilgrimage. For those who can't take the big pilgrimages, they can do these little pilgrimages of their own through a journey of circles towards and away from the center. And for me, I love symbolism. And as I say, I like to contemplate and meditate by being active. So for me, this is it's a 200-meter long journey in circles that are tighter and looser as you go through this labyrinth. And for me, that's a method for me to regularly reflect in the beauty of that natural environment with birds singing and cicadas chirping away. I reflect, and I try and reflect a lot because I know that my lifestyle naturally takes me away from reflection time, but I know that's really important. And the physical pillar, touching on the psychological one also, I attended a couple of years ago a silent retreat for 4 days of no speaking. And without going into that in any detail, the facilitator of that, right at the beginning, said to us, listen to your bodies. This is a chance for your bodies to catch up with your minds and your emotions and your spirit. And if your body tells you all it needs to do is sleep, then for the next 4 days, sleep. Because so often in our busy lives, we are just running so far ahead of what our physical needs tell us are important. And then we suffer the health consequences of that. So that was a good prompt. And it's part of my practice is to try and pause and reflect on my busyness and the things that are occupying my brain and my emotions and my relationships, and just to examine, is this good for me? Is this good for my physical body? And for me, making sure that pausing regularly, taking time out. I love being outdoors in natural environments. So any opportunity I have to take bushwalks and to go paddling on a river or a lake or in the ocean, or to walk the dogs. These are the ways that I physically can feel myself replenished, as well as the routine of good sleep and good eating and regular exercise. A long-winded response to your probing question, David. I hope I've done it some justice.
You absolutely have, and I'm intrigued that you actually started the other way round to my standard physical, psychological, emotional, spiritual. You went spiritual is number one, then emotional, then psychological, and then finally physical. What I heard was it's a constant work in progress. And that's such an important message because it's part of your adapting to life's changing circumstances. Your children have left home. You and your wife are empty nesters, and you're exploring what that means in your life. So I had to write down what you were saying about deconstruction, reconstruction, because that's actually where I'm going at the moment in my thinking around the positive medicine model. And how it compares to the traditional medical model, which deconstructs, which analyzes the scientific technique of analysis, breaking components down, breaking wholes down into their component parts. We found where the problem is. It's your liver function. You're drinking too much. But the answer, the solution doesn't lie in the part. The solution doesn't lie in the deconstruction. The solution lies in the reconstruction, the putting together of the parts. In systems thinking, that's called synthesis. bringing the parts together to make a whole that is greater than the sum of the parts, which is our life. Our lives are so much bigger than the sum of the parts. And I think that's a really, really important positive medicine message. But yours was a really good answer in terms of your positive medicine way of life as a constant adaptation to changes. And it was Darwin who said that the greatest principle of evolution is actually the ability to adapt. It's not survival of the fittest, it's survival of the most adaptable to changing circumstances. Andrew, it's been an absolute pleasure talking to you as always. I'm excited that we're going on this journey together, that our lives have interconnected and we're sharing elements of our lives together on the positive medicine journey. Thank you for coming on the Positive Medicine Academy and giving us some governance and leadership in that space too. So much more to happen. Come back soon and let's fill in some gaps. Thank you, Andrew Corin.
Thank you, David. It's been a delightful conversation. Thanks. Well done.
I hope you enjoyed the episode. I know I did. You want to hear more? Come and join us for the next episode here.